Welcome to yet another informative health segment brought to you by Batson and Associates. I am Mr. Paul Jabari Green, Senior Consultant at Batson and Associates. I form part of a dynamic team of consultants that is headed by Dr. Jason Batson, the Senior Medical Director. We at Batson and Associates are very excited to give you a practical ways of how you optimize overall health through the means of natural and integrated medicine. Today, listeners, we have yet a very interesting program for you. We want to focus on men and men's health. Yes, men, we tend to be a bit more reluctant to really looking at health-related problems. We sometimes see work as most important and really putting our health at secondary level. Now, we want to specifically speak on prostate and prostate-related issues and the type of prostate-related issues that men can suffer from. But it's important first to recognize or understand what is the prostate. Well, the prostate is a small gland that is located under the bladder that passes a tube called the urethra. That tube, urethra, that is where semen is passed or seminal fluid is passed, also urine is passed. Now, this particular small nut-shaped or nut-sized gland can become very volatile. And in doing such, it means that we have to now understand what are the multiple issues that can result from that gland. Now, take a look with me at this particular diagram. This diagram represents the urinary tract system of a man. This represents a regular size-shaped structure of a bladder along with the prostate and the urethra. Now, gentlemen, this particular organ is what allows the collection of urine that is then passed through and regulated by the prostate gland. The prostate gland is commonly known to allow for seminal fluid, but it also regulates the flow of urine. This prostate gland is where a lot of our problem lies and in many instances can become volatile. There are a couple factors that allow this prostate to become volatile. One, prostatitis. Prostatitis is the inflammation of the prostate gland. When this prostate gland becomes inflamed, there's a significant enlargement that then decreases the movement or decreases the size of the urethra, which then squeezes that gland and prohibits the movement of urine. Some common symptoms of this can be seen in, you may have the urge to urine, but there's a significant delay with the actual flow of urine. So you go to urine, but there's a delay. Additionally, what can occur is that you have painful urinations, or in some instances, even blood in the urine. Now, another thing that can then cause inflammation of the prostate gland is a UTI. For men who are having urinary tract infection, this gland could then be infected, which causes, again, an enlargement or prostatitis or inflammation of the prostate. Another factor that causes this gland to move from an area of regular shape or normal size into enlarging state is known as benign prostatic hyperplasia. Benign means non-cancerous, hyperplasia means swelling. When this occurs again, gentlemen, the same thing disallows, where there's difficulties for the movement of urine from the bladder to the urethra. Now, in most instances, benign prostatic hyperplasia is treatable, maybe through the means of medication or medication that then prohibits or reduces this particular prostate gland. What it is we want to focus on likewise this morning is that this particular gland can also be affected by prostatic cancer. In areas where there's prostate cancer, the cells that are located within this prostate gland becomes malignant. Malignant means can spread, or cells or cancer, which really means the abnormal growth of cells. The abnormal growth of cells then could allow this particular gland to become quite enlarged, which significantly also reduces the shape and the structure of the prostate gland. Who is at risk of prostate cancer? Who is at risk of prostatitis? Who is at risk of benign prostatic hyperplasia? Well, all men really. As long as you have a prostate, at some point you may really develop some level of prostate-related issues. Maybe it's a case of short-term acute enlargement or prostatitis, which might be caused due to a urinary tract infection. Or in some cases, you can have a more long-term enlargement, which is known as benign prostatic hyperplasia. Or in some cases, you can then develop prostate cancer, which is a malignancy or irregular growth of cells that occurs within the cells of the prostate gland. Either way, most men are affected or are predisposed to some level of enlargement. Then what are those factors that significantly cause that? Well, there's a cases of hormonal imbalance. And there's a direct link between that as well as your diet. So high amounts of processed meat or high amounts of red meat, there's a direct link that could absolutely cause a prostate gland to become volatile. In some instances, the job you do. So if you're exposed to high amounts of chemical, that could also impact the livelihood and the health of the prostate gland. In addition to that, there are some studies that indicate that there may be some level of genetical link to that of the prostate. Then what do we do? Well, we at Batson and Associates, we have developed a system and a protocol that focuses on the prostate management and overall health and wellness of men. What it is I want you to understand is that because you're already exposed or because you run a very high chance of developing some level of prostate-related issues, then we have to do everything in our power to ensure that this gland behaves or remains within its regular size and its normal health and functionality. How is the prostate diagnosed, or how is prostate-related issues diagnosed? Well, there are a few procedures that can really give you a good insight as to what is happening. At Batson and Associates, there's an organ scan that looks at your indicators to see whether or not you may be suffering from prostate-related issues. Also, that is then attached to other tests that is done. One, there's a test known as a PSA blood test that looks at a particular antigen. So PSA is short for prostate-specific antigen, which is really a protein that the cells in the prostate actually develops or produce. These proteins are then measurable on our regular blood test or PSA blood test that will show us whether or not those figures are elevated or not. Now, these cells can and will make PSA or that antigen. However, cells that are malignant significantly increases the production of PSA, which shows you clearly whether or not you might be at a risk of having prostate cancer. Another procedure that is done that will give you a good insight as the behavior of the prostate gland is a prostatic ultrasound. This particular procedure is a non-invasive procedure that will show the structure and the size of the prostate gland so that we can then better understand whether or not you might be suffering from enlarging prostate or prostate-related issues. At Batson and Associates, we are committed not only to allow you to understand prostate-related issues. However, we are able to give you practical information, treatment protocol that is aligned with your specific needs. We are able to assess each client, assess their deficiencies, assess their needs, and then result or create a program that is specific for you. We are then able to do a consultation to really assess where you are, assess your medical history, and then create a protocol using our methods of assessment. We're going to do a blood analysis. We're then going to run a couple critical body function analysis tests to then see where you are. We are able to then align a program that is specific for you to ensure that we are able to then maximize or improve your overall health. At Batson and Associates, we are not limited to only dealing with prostate-related issues, but we're able to really help all clients with whether it may be diabetes, hypertension, renal or liver-related problems, clients that may be having issues related to PCOS, fibroids, cysts, endometriosis. We are able to really treat all ailments from a perspective of natural as well as integrated medicine. While today's program was focused on men and men-related issues, we are still reminded that we're in the month of May, and as such, we are celebrating women's health. Y'all, we have such excellent news where we have a competition where 3 amazing lucky mothers have an opportunity to win a chance of $1,000 in a full test package. Let me say that again. 3 lucky mothers have an opportunity to win $1,000 test package that will be totally free. I also want to remind you all of our health symposium that is coming to Tobago for 3 days straight from the 30th of May to the 1st of June. Again, that is from the 30th of May to the 1st of June. Subsequent to that, we're going to have an amazing week-long marathon from the following week, from the 3rd to the 7th of June, where there will be consultants available for all your appointments. All your appointments from the 3rd of June to the 7th of June. We still remember our senior citizens, and as such, on the 29th of May, our senior citizens will be offered a free MRI scan with all their visit appointments. Again, free scan for all visits of consultations. You all book your appointment today. start your journey off on the right foot. Optimize your health. So contact us at 222-8261 or 314-9975. That number again is 222-8261 or 314-9975. Start optimizing your health today. And don't forget, if you think health is expensive, try sickness. And if you think education is expensive, try ignorance. Thank you and have a great day from Batson and Associates.